everyone, welcome to YourPedia and this is Shikha. So friends, if you are also preparing for the group discussion for PSUs, for campus placement or any other organization basically, so this particular video is going to be help you out as we are covering regularly the current GD topic basically, which is very important from your examination point of view, from your GD point of view of course. So today the topic of discussion is, I can say it out, this is healthcare accessibility in developing nation, challenges and solutions. Whenever a country is developing, it always they have to be look after a lot of things: infrastructure, healthcare, education, poverty, unemployment, hunger, lot of things are there, right? So in that basically particular thing, some of the things might be left somewhere. So yes, with the increasing population in India, healthcare accessibility is also going to be very difficult, and it can be a global challenge as well, which is including infrastructure limitations and scarcity of resources. Lot of things are there. So yes, basically what are the important, or you can say the major challenges, that is severe resource constraint. सबसे पहले आता है कि रिसोर्स का बहुत ज़्यादा कंस्ट्रेंट होता है. That is, developing nations face critically low funding for healthcare infrastructure. Yes, of course, personnel, the staff and essential supplies, it's very important, right? Then it comes to geographic barriers and infrastructure deficit. Of course, road networks आ जाते हैं उसमें, lack of transportation, long distance, बहुत सारी चीज़ें हैं basically जो कि especially in rural areas that are hindering basically to get the treatment and to get the healthcare accessibility, right? Then it comes to critical shortage of skilled health professionals. Yes, somewhere it is a major challenge. Why? Because yes, doctors needs to be look after the treatment. So it is something that I can say it out, that is very shortage of skilled labor or skilled doctors, I can say, right? The MBBS, the MBAs like that, but still they should have some experience, they should have vast knowledge. So a lack of trained doctor, nurses, midwives and community health workers severely limits the capacity to deliver adequate care. And yes, it's very true. Then it comes to low health literacy and awareness. This is something. Insufficient education and disease prevention, hygiene and when to seek medical help contributes to delayed or no treatment. जब तक, until or unless we are not aware about the health facilities, health literacy, we are not able to get help for ourselves as well. So it is very important that we need to be look after this particular challenge. We need to be make aware people about health literacy and how does going to be help us. Then it comes to weak supply chains and logistics. Of course, inefficient system for procuring, storing, distributing medications and medical equipment leads to shortages and stock out. ये बहुत major है basically. Then it comes to inadequate water and sanitation infrastructure. Yes, clean water नहीं है, proper sanitation facilities नहीं है, likewise, ठीक है, high burden of communicable and non-communicable disease. Developing nations often grapple with double burden of infectious disease and a rising prevalence of chronic condition, right? Then it comes to fragmented and under-integrated healthcare system. Lack of coordination between levels of care and public-private sector leads to inefficiency. Of course, sometimes hospitals used to refer the patients from one place to another, and that is something where we are taking the risk for the patient life. Of course, they are not coordinating with each other, right? There is a lack of coordination. Then it comes to, it leads to very inefficiencies, of course, gap in service delivery. These all things are, of course, which is contributing in this. Then it comes to what are the major solutions which we can take to prevent and to go for these challenges. This is increased and targeted financial investment. This is something governments and international donors should prioritize and allocate more resources specifically for strengthening primary healthcare system. Yes, it's very important. International government, you can say the international donors, they should think that the developing nation should, I can say they want more funds to raise their infrastructure, to raise their healthcare accessibility. Then it comes to strategic infrastructure development and outreach program. It is to investing in transportation, mobile clinics and telemedicine basically, which can extend healthcare access to unreserved populations. Then it comes to scaling up and retaining a skilled health workforce, right? We need to be expand training programs, we need to be offer incentive, we need to be stay updated through the current technology, the current knowledge in health sector, of course, health industry. Then it comes to we need to be address the improving working conditions, can of course it can be address the shortage of healthcare professionals. Then it comes to community based health education and empowerment. अब इसमें क्या है, we need to be implement culturally sensitive health education initiative जो कि health literacy को improve करे और preventive behaviors को भी promote करे. Then आता है फार्मास्यूटिकल सप्लाई चेन्स और लोकल प्रोडक्शन को उसको स्ट्रेंथ करना, बिकॉज लॉजिस्टिक्स और सप्लाई चेन की वजह से कई बार इट गॉट इन लैक्स. ठीक है, इन्वेस्टिंग इन एफिशिएंट प्रोक्योरमेंट, स्टोरेज, ठीक है, एंड ऑफ कोर्स मेडिकेशन में इन्वेस्ट करना प्रॉपरली सारी मेडिसिन, आई कैन से पोटेंशियली लोकल मैन्युफैक्चरिंग कैन एंश्योर रिलायबल एक्सेस टू एसेंशियल मेडिसिन्स. Then it comes to integrated public health interventions, combining efforts to improve water, sanitation and hygiene with healthcare delivery can have a significant impact on disease prevention. Yes, आपका public health interventions बहुत ज़्यादा important, जिसमें आपका water, sanitation, आपका healthcare delivery, उसमें सब कुछ आ जाता है ओवरऑल कि आपका infrastructure, accessibility of clean water, ये सब कुछ बहुत ज़्यादा important है. Then it comes to building resilient health system in fragile context, that is strengthening health system to withstand shocks and ensuring continuity of care during and after conflicts is crucial, right? Then it comes to integrated disease management program. Abhi we are talking about the communicable and non-communicable disease, ठीक है, that is the that challenge come with lot of causes, of course, that is stagnant water is there, ठीक है, poor I can say sanitation, or you can hygiene facilities are not there, you can say it out. So what we can do is, of course, integrated disease management program we can start up, that is implementing comprehensive programs that address both infectious and chronic disease. अर्ली डिटेक्शन से वो प्रोटेक्ट की जाए एंड उसको मैनेज किया जाए, ना कि वो स्प्रेड आउट हो. ऑलराइट, सो यस, दीज आर सम सॉल्यूशंस व्हिच वी कैन टेक, and these are major challenges which the developing nations are facing this time in healthcare accessibility. So yes, it's very generic or very good topic to be discussed related to healthcare, and we must prepare this. You can download this documentation from YourPedia panel, can practice these topics in regular live sessions of YourPedia, and as we are conducting GDs every day. So yes, I have provided a skeleton to what are the important pointers you can speak in your actual GD, right? So all the very best, and keep yourself updates with the current GDs with YourPedia. All the very best. Good luck.